The early days of childhood are typically carefree, with only concerns of striking out on the field or with your crush in your fifth grade class. When kids have their minds in other places, they count on their parents to pay attention to what makes them tick, their heart health. Now, did you know that there is a chance that your child may be at risk for heart disease? Well, our sponsor, Children's Hospital of Michigan, is home to specialists who can provide care for your child's heart. And joining us to share his expertise is Dr. Peter Sasalaus, a cardiovascular surgeon at Children's Hospital of Michigan. Thank you so much for being with us.
It's my pleasure. Thank you for
having me. This is
me.
incredibly important information, so I'm glad that we're talking about it. But what are the types of heart disease that happens in children?
Well, I think most often people associate heart disease with adults, but actually heart disease can occur in children. And we typically divide heart disease in children into two categories: congenital heart disease, which is present from birth, and acquired heart disease, which can occur over time as a child grows. The most common type of heart disease that we see is congenital heart disease, and that can have long-lasting effects if untreated. There are multiple treatment options, though, from lifestyle modification to medical therapies to catheter-based procedures, and lastly, surgical treatment, which could range from more simple repairs to complex reconstructions of the heart and even heart transplantation. The good news is, though, that even for the most severe forms of heart disease now, there are treatment options available.
Oh, that's great to hear, because all of it sounds so overwhelming and intimidating, so that last line is very comforting.
Very important.
Their treatments. So what are some of the signs in heart-related conditions in children?
So the heart is complex and symptoms can vary. It could be caused by weakened heart muscle. It can be caused by leaky or narrowed heart valves. You can have holes in the heart with mixing of the red and the blue blood, or you can have abnormal connections in the heart with abnormal flow and blockage of heart vessels. So in terms of these symptoms, you can have a wide range, and it really depends on the presentation and the type of heart defect and the age of the child at presentation. So there are some red flags that families should be concerned about. In babies and newborns, having bluish discoloration of the lips, change in skin color, cool extremities, and labored breathing. In infants, having poor weight gain or failure to thrive, sweating or difficulty with feeding. In young children and adolescents, they can have chest pain or fainting with exercise, although symptoms are more subtle in terms of fatigue, decreased energy level, or not being able to keep up with their siblings or their friends when playing. Regardless of the age, though, it's very important to remember that persistent breathing problems are not only lung problems, they can be a sign of a serious heart condition in children.
It's great to know. These are great tips. Now, should a child be screened for heart disease, and if so, when?
Absolutely. Screening is very important, and it actually starts before a child is born with an ultrasound by an obstetrician. Also, parents are not aware usually, but screening occurs in the hospital when a child is born before they even leave. And once they leave, they have screening every time they see their pediatrician. They're getting vital signs checked, they're getting a good thorough physical exam, listening for murmurs and checking for good pulses. In addition, there are some children with additional risk factors that require extra screening. Those include kids who are obese or overweight, those children with diabetes or chronic medical conditions, if they have a family history of premature heart disease, or if they have an unknown family history, as in the case of adoption. If any of these risk factors apply, families should reach out to their primary care provider to get the appropriate screening.
Okay, and the provider will let them know this is what the kid needs at this time based on their circumstances.
Absolutely.
Correct? This is awesome. Well, is there a way that a person can help lower their kid's risk for heart disease then?
Yes, there is, and it's certainly important to put your kid's health at the top of the list. So by introducing a nutritious diet and encouraging physical activity is a really great start. It can be simple things like taking family bike rides or playing in the backyard soccer several times a week, and things like that can really reduce the risk and help prevent heart problems in the future.
Probably less screen time, more playtime?
Absolutely.
I had a feeling you were going to say that. Dr. Sasalaus, thank you so much for all of this great information. So I should ask you this as well. What type of heart screenings are available?
Yeah, so there are many types of heart screenings. Some of them are simple, like weight checks, vital sign checks, blood pressure screening, a thorough exam. And then there's additional screening like blood work, electrocardiograms, chest x-rays, and an echocardiogram, which is an ultrasound of the heart.
Okay, very good. Well, thank you again for all of this great information. We appreciate it.
Thank you for having me.
To learn more about the cardiovascular services at Children's Hospital of Michigan, visit childrensdmc.org/heartcare4kids. Again, that's childrensdmc.org/heartcare4kids.